Welcome everyone to my topic presentation, What is Killing the Children of Pakistan? How many children die each year? Over 400,000 infants die before they turn 1, and 1 in 10 die before they turn 5. An article in the Pakistan Express Tribune said that 1 child dies every minute in Pakistan. So with these alarming numbers, you may be wondering where Pakistan is ranked in infant mortality, meaning death before the age of 5. As of 2018, UNICEF has ranked Pakistan number 1 in newborn mortality and number 3 in death before the age of 5. In Pakistan, 1 in 22 infants die. To put this in perspective, Japan is ranked number 1 in infant survivability. Their death rate is 1 in 1,111 children. So what is the leading cause of death among Pakistani children? The number 1 killer of children in Pakistan is pneumonia. What is pneumonia? According to the Mayo Clinic, pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. What causes pneumonia? A variety of organisms, including different types of bacteria, viruses, and fungi, can cause pneumonia. According to the Pakistan Medical Association, Pakistani children suffer from malnutrition. This weakens their immune system, leaving them vulnerable to pneumonia. Is it preventable? Yes. The majority of cases can be prevented with vaccines and teaching mothers the signs to watch for when their babies are in respiratory distress and in need of antibiotics. It would also help if the children weren't in poor health because of starvation and unsanitary living conditions and drinking water. In a report from UNICEF, they said, more than 80% of newborn deaths can be prevented with access to well-trained midwives, along with proven solutions like clean water, disinfectants, breastfeeding within the first hour, skin-to-skin contact, and good nutrition. If it is so easy, why aren't they doing it? The main reason is that there simply isn't any money. The majority of these children are in rural areas. They scavenge for food, water, and anything of value. They are not born in hospitals or even with anyone with medical training being present. Doctors are too expensive and can't be trusted. Mothers know their child is sick, but don't think anything can be done about it, or they can't afford it, so it doesn't matter. 1 dose of 1 vaccine is more than lots of families make in an entire month. And even if it could be afforded, it is too far for them to travel to get them. What does the future hold? According to the World Health Organization, Pakistan did reach out for help and received financial assistance for vaccinations by the Gavi Alliance. They agreed to pay for Hib vaccines for every child in Pakistan. This was in 2010. You can see in my report that this has made very little difference. Why is that? There are a few reasons for this. They started distributing shots in school. This doesn't fix the problem of children under the age of 5 dying. And as we learned last week, there are 25 million children not in school in Pakistan. Another reason is how the government is disseminating the information. They have a health education initiative that uses social media, billboards, and flyers like the one pictured here. What's wrong with this, you might ask? Well, only 19% of the population has access to the internet. And as we learned last week, only 58% of the country can read. And that number is even lower in rural areas like Bukistan, where it is only 22% of the population, and the majority of these are males. If mothers can't read, what good does it do to hand them a flyer? It is clear that this is a serious crisis, but unless more clinics and hospitals are built in rural areas, until the rampant poverty is helped, and until mothers are educated, nothing will change. These are my sources. Thank you so much for listening.